surgery or conservative care for asymptomatic aortic stenosis. Definition: aortic stenosis is the most common valvular disease for which surgery is indicated in developed countries, and the prevalence of this condition is increasing because of the aging population.
Patient will become weakened, short of breath, develop chest pain.
These classic symptoms fit a number of health conditions, so it's not uncommon for aortic stenosis to get picked up late in elderly patients.
More often than not, it's just deterioration of the valve from the aging process where calcium will build up on the valve.
Aortic stenosis may be undiagnosed in hundreds of thousands of people across the U.S. They have symptoms but don't recognize the urgency.
If you have severe aortic stenosis, the mortality in the first 2 years is about 50%.
There is no medical therapy to cure aortic stenosis or slow its progress. The only treatment is an operation to replace the valve. By the time many elderly people learn they have it, they could be in poor health facing surgery.
The standard operation was to open somebody's chest, put them on the heart-lung machine, stop their heart, open the aorta, cut out the valve, sew a new valve in.
Greater awareness may lead to earlier detection. 75% of patients are male. Calcium buildup is the most common cause. It is also linked to a congenital heart defect and rheumatic fever. Risk factors are age, hypertension, smoking, elevated lipoprotein A, and high LDL cholesterol. Surgeons are now able to operate on people once considered too weak for open heart surgery.
Utilizing basically the same sorts of valve materials that are available through standard operation, but now delivering it by a catheter.
Called TAVR, a new valve is delivered through a catheter threaded through the arteries in the groin or directly through the chest wall, expanding treatment for one of the most heart-wrenching conditions. For Lee Memorial Health System, I'm Amy Osher.
Applications in medicine. Aortic valve replacement is the only effective therapy for severe symptomatic aortic stenosis, and despite limited data from randomized clinical trials, current guidelines recommend aortic valve replacement because of the dismal natural history of this disorder.
Aortic stenosis is a heart valve disease that affects as many as 1.5 million Americans. It becomes more common with age, affecting 1 in 10 people over the age of 75. Left untreated, severe aortic stenosis leads to decreased quality of life, heart failure, and even death. Aortic stenosis occurs when the aortic valve, the main outlet for blood being pumped from the heart to the body, becomes abnormally narrowed. In older adults, stenosis is typically caused by wear and tear and the gradual buildup of calcium deposits that stiffen and narrow the valve, keeping it from opening properly. As the valve narrows, the heart has to pump harder to push blood throughout the body, and this can lead to symptoms like fainting or nearly fainting during exertion, chest pain, weakness, and fatigue. While not all aortic stenosis patients experience symptoms, 3 out of 4 older patients with severe aortic stenosis do. However, many dismiss these warning signs as normal aging. This often leads to the underdiagnosis of aortic stenosis. Those that experience aortic stenosis symptoms have diminished quality of life, making everyday activities like climbing stairs and walking increasingly difficult. If you or a loved one has aortic stenosis symptoms, it's important to seek medical attention promptly. Simple tests are used to diagnose aortic stenosis. Aortic stenosis produces a very distinct heart sound, a murmur, and is usually detectable with a stethoscope. But other tests may be necessary. Over time, aortic stenosis strains the heart, causing the heart muscle to become thicker, weaker, and scarred. Without treatment, severe cases lead to heart failure and death. Medications can treat chest pain or other symptoms, but none can reverse aortic stenosis. Only repairing or replacing the defective valve will eliminate aortic stenosis. Without surgery, 50% of patients with severe aortic stenosis don't survive more than 2 years after the onset of symptoms. Aortic stenosis treatment typically requires aortic valve replacement surgery, or AVR. This surgery replaces the defective valve with a mechanical or tissue valve. AVR improves quality of life and increases survival in most patients. But those at high risk for surgical complications may not be good AVR candidates. Fortunately, recent medical advances give new hope for those who cannot tolerate more invasive surgery or are at high operative risk. TAVR, or transcatheter aortic valve replacement, is a new technique in which a valve is placed by inserting a catheter through an artery in the leg and threading it to the heart. This procedure is minimally invasive and does not require the chest to be opened. There are risks associated with TAVR, including stroke and damage to leg vessels. Aortic valve replacement is still the preferred treatment for most aortic stenosis patients, but TAVR represents a potentially life-saving alternative for those who cannot tolerate more invasive surgery. If you or a loved one has been diagnosed with aortic stenosis or is experiencing symptoms of aortic stenosis, talk with a healthcare professional right away. Get prompt medical attention for fainting or nearly fainting during exertion, chest pain, weakness, and fatigue. And remember, aortic stenosis is a treatable condition, and older age is not a barrier to valve replacement. Brought to you by the Alliance for Aging Research.
Pros and cons. Pros: one-third to one-half of patients with severe aortic stenosis are asymptomatic at the time of diagnosis. Appropriate timing of intervention for these patients remains controversial. Cons: the potential benefit of aortic valve replacement to prevent sudden death in asymptomatic patients may not be greater than the risk of death during or within 30 days after surgery.
My name is Janet, and I'm 83 years old. I like to golf when I'm able to, and I hadn't been able to very much lately. I had shortness of breath and some pain, and after going through some testing and observation, it turned out they wanted me to have open heart surgery, and it was very upsetting to my family. I went to Spectrum Health to get a second opinion. I saw 3 different doctors. They did not think that I needed the open heart surgery. When they told me I could have the less invasive procedure, I was very relieved. I had confidence in them. Spectrum Health performed 254 TAVR procedures last year. I was only in the hospital 2 days following the procedure, and I did not have to go to rehab. People don't realize that there is such expert care right here in Western Michigan. They don't realize perhaps they can get help that close to home. Something had to be done, and I'm glad that it was done the way it was, and I'm very thankful.
Issue applied in Ecuador. In Ecuador, advances in surgical techniques and aortic valve prosthesis may change the risk to benefit ratio of aortic valve replacement, especially among patients at low surgical risk.
The transcatheter aortic valve replacement procedure is performed on patients who have severe calcified aortic stenosis. And here you see an aortic valve that's not opening well. It's severely calcified and the leaflet motion is restricted. So to perform the TAVR or transcatheter procedure, a wire is inserted in the femoral artery. It is threaded up through the aorta and around the aortic arch. And then that wire is passed through the stenotic aortic valve and placed in the left ventricle. Following that, a balloon catheter is passed over the wire into the stenotic aortic valve. The balloon catheter is then inflated, opening up the stenotic valve, cracking the plaque, and freeing up the leaflets. And that's in preparation for the stent valve or the transcatheter valve to be inserted. And the first rendition that you see is the first stage of the catheter going in, and then the second stage of the catheter coming through around the aortic arch over the wire, and it's going to insert into the stenotic valve. Once the catheter is placed in the valve, the stented valve is ballooned open, pushing the diseased leaflets out of the way.
Conclusion: the incidence of death from cardiovascular causes could be lower among patients who underwent early surgery than among those who received conservative care.
TAVR is a minimal invasive procedure, stands for transcatheter aortic valve replacement. Aortic stenosis is a disease of the aortic valve. The aortic valve is like the door of the heart, and when it becomes narrow, patients become symptomatic, meaning they have shortness of breath, chest pressure, sometimes they even pass out. So a TAVR is a procedure that can replace the traditional open heart surgery. So the procedure starts with numbing both groins. We put lidocaine under the skin, and that prevents the patient from having pain. The patient will be under light sedation, and we will insert catheters. Catheters are plastic tubes that allow us to inject contrast or advanced devices through them into the heart. We will then advance an aortic valve bioprosthesis. Currently at Tallahassee Memorial Healthcare, we have the two devices that are approved by the FDA to treat aortic stenosis. The Edwards valve is a balloon expandable valve. The valve is mounted on a balloon. So as a stent, you would put it in the position that you prefer and then inflate the balloon. That will expand the valve. Once expanded, the valve is already functioning. The Medtronic valve is contained within the catheter. The Medtronic valve is made of a material called nitinol. Nitinol is a material that has memory, so the valve is always wanting to be in their original position. We put it inside of the catheter, and once it's in position, we release it by removing the catheter. The valve deploys itself. By treating aortic stenosis with a TAVR, we are making patients live longer and better. That means no shortness of breath or chest pain or passing out while doing their regular activities or even exercise. The evidence has supported that the FDA has approved this therapy for people with intermediate risk for surgery. However, there are at least 2 trials that have shown that this is beneficial also for low-risk patients. So the population that will benefit from this procedure has broadened. The heart team is composed by several people, from cardiologists, invasive and non-invasive, heart surgeons, nurses, anesthesiologists, coordinators, We all are with one mission, which is to provide that patient the best option available.